Hello, everyone. We're starting our monthly webinar for weight loss surgery in Mexico. I am still seeing people joining, so I'm gonna give it a little time here, a minute or two, for everyone to join. We have Dr. Alejandro Gutierrez from our hospital Azar in Tijuana, and I myself in our office in Sacramento, California, in Folsom, specifically. This is our main office. And well, thank you again for joining us. It's a pleasure to have all of you and be able to go over our presentation, the services that we provide. We have established MBC right now is one of the top leaders in quality healthcare, including weight loss surgery and plastics and other endo procedures. And we are a leader not only in the top quality VIP treatment of patients, we are one of the lowest prices in the industry. And you gain quality care for affordable prices. This is just to make sure that everybody knows about this raffle. We do a $2,000 off of surgery package raffle with our webinars. And in order to qualify to participate, basically all you have to do is have a health questionnaire submitted in our system. If you have not done that, please go ahead and go to MexicoBariatricCenter.com and go to health questionnaire. If you have not submitted, select Dr. Alejandro Gutierrez. If you have, we can always switch you. Again, this raffle is for Dr. Alejandro Gutierrez only. And fill out the HQ and watch to the end of the webinar. At one point toward the end, I would release the Zoom poll, and I need you to do that part too. And then we do the raffle after Q&A session at the end. Again, this is our monthly webinar for weight loss surgery in Mexico. And our guest today, our chief surgeon, Dr. Alejandro Gutierrez from our hospital Azar in Mexico, Tijuana. A little bit about myself. I've been in the medical tourism industry in Mexico since 2007. I have traveled all locations in Mexico, and I know a lot of facilities, hospital facilities and doctors and surgeons. And I started MBC, Mexico Bariatric Center, in 2012. And it was a dream for me to start our own hospital. And this is a project I took over in 2021. And we finished it finally in September of last year. Our patients are so thrilled to go to our new hospital. We get nothing but good reviews, and they love it there. The experience, the care is beyond extraordinary. So actually, when I was there a couple of weeks ago, we got our first patient, the 1,000 patient, and they were celebrating the 1,000 surgeries a few weeks ago. So this is, there are some new updates that we can go over later about companion visits, companion stay, all that has changed for better. We try to cover as many commonly asked questions during our presentation. And I want you to pay attention so we would not have to repeat it at the end, but we would be more than happy to answer questions at the end. If we did not get to all questions answered, please circle back with our office here, with our coordinators, and we will be more than happy to answer you. These are just the topics that we're going to cover today about obesity and its risks, how to calculate your ideal weight loss, and we would see how weight loss surgery is different from all the other options, including Ozempic-like medications. Then we talk about MBC. We talk about our new hospital, Hospital Azar. And we will talk about logistics of when to come, when to leave, what's the pre-op diet, all that. And then the patient support system that we have for you in MBC, I would outline that. And then Dr. Gutierrez is going to cover all the procedures that we offer, and you're going to be impressed by the amount of expertise we have with our surgical teams. And then I will take over again at the end, talk about financing, nutritional support, and we would do the Zoom poll, and we would open up for Q&A. At the end, again, like I said, make sure you have a health questionnaire in our system so we qualify for raffle drawing at the end. We all know what obesity is, right? Is really a disease, and the more research is done, they are finding out that this is a metabolic disease. And of course, you know, our lifestyle, the way our nutrition is, the way our lifestyle, physical activity is not helping the situation. And we really have, as human beings, no defense system against overeating, ultra processed foods, sugary drinks, all that. So this is really combining with our genetics, our lifestyle, and everything else to combine to a big epidemic, which is called obesity. Now, in the medical field, they have a formula that you put your height and weight, and we have a calculator online. There is a, if you look everywhere, there's one you can find. You put your height and weight, and you get a range of where you're standing in this chart. Anything below 30 still is not considered obese. Of course, again, I want to emphasize our body shape, our muscle mass, all that, our bone structure, the shape that we are in is also a huge factor. But this is like a general formula that kind of puts you in a chart that you can tell where you are at, right? And we'll see in a little bit of how to find your ideal weight. One thing about our center is we don't have any limitation of what we can handle as far as BMI. We have performed operation on patients of 110 BMI. As a matter of fact, I just had a patient that is signing up from Florida that he is 620 pounds coming to Tijuana. So these are, and we make special accommodations, you know, we know how to handle these patients with high BMI. So no worries that you're not capable of handling those. Now, I promise you how to calculate your ideal body. It's very easy, right? So there is a chart for male and female and your height based on your frame size. As you see, let me do this real quick. Okay, so let's say, let's go by an example. Okay, so let's say I'm a 5'4" medium frame female and I am weighing at 220. As you see in the chart for 5'4", for medium size, ideal weight is 120. Okay, so that's my ideal weight. Let's say if I weigh 220, I have 100 extra pounds to lose. And then you see the literature that says, okay, if you get gastric sleeve, you lose 70%, or if you bypass 75 or 80%. For duodenal switch, you lose 85%. So according to the published data, at 100 pounds extra, you would lose 70 pounds with gastric sleeve. So 220 is your weight right now, current weight. You take 70 out, and you end up with 150. Now, this is, again, a published data. We see our patients lose 100% of their extra weight. So when you see percent EWL, extra weight loss, that's what it means. Okay, and there is no limitation because you're acquiring a tool to help you get to your ideal or goal weight. Of course, everyone's goal weight could be a little different from your ideal weight, but that's how you come up with that number. This is a little data that we gathered from, it's not little actually, these are from thousands of patients that have gone through our system, but it shows what our patients are experiencing from gastric sleeve, bypass, mini bypass, and duodenal switch after 3 months, 6 months, 12 months, and 18 months. As you see, again, after 18 months, you're still losing weight, at least to 2 years. And that's what we call a honeymoon time, right? The first 2 years, you're going to keep losing weight. And if you look, you know, the published data is between 65 to 75% for sleeve. At 18 months, we're almost at 75% average of patients. So this shows the skill of our surgeons. This shows how we do support these patients before and after, and this is the outcome, right? For bypass, 80% in 1.5 years. In mini bypass, 81. Same thing with duodenal switch. Now we're going to see the difference between duodenal switch and bypass. I just read an article for 15 years out that duodenal switch had a much better outcome as far as weight loss, sustainable weight loss, and reversal of comorbidities like, you know, diabetes type 2, high blood pressure, and all that stuff. Okay, so this is another chart that you see the difference between different surgeries. And as you see, duodenal switch, which is the orange, has the most efficacy. Yeah, in the 18 months, as you see, is the, you know, if you look at 3 months, 6 months, 12 months, and 18 months. Again, we talked about what is contributing to obesity, increased nutrient content of food we take, lack of activity. Sedentary life is what we do all day, you know? We sit around at our computer work or go home, watch TV. This is all contributing to that. They were saying like, at least we have to take 30-minute walk every day. If you're busy, maybe divide it up to 3 times 10 minutes. And these are all crucial for us to be keeping, you know, even with the weight loss surgery, you still have to eat well and you still have to do the physical activity. And, you know, stress eating, that's huge, inadequate sleep, and we are used to large meals. So when we gain weight, our fat cells, or called adipose tissues, structure changes. As a matter of fact, the testosterone gets converted to, you know, estrogen, and all these other problems come with it. So as you see this picture, adipose tissue or fat cells of a lean person on the left of my screen is different from adipose tissue of an overweight or fat person. And this inflammation is causing all the insensitivity to insulin, leptin, to therapies, vaccination. Even protein and exercise does not have the same effect on our muscles as a regular person, a lean person. So we call it anabolic resistance. So there is so much that can happen from gaining weight. And is a risk factor for, as we see, like, for example, 40% of adult Americans are struggling with this problem. Heart disease, stroke, diabetes, lung disease, immune system, impairment in immune system, chronic inflammation. We mentioned that. That's huge. And during COVID, we found out that we need to live a healthy life because the coronavirus attach itself to the fat cells. The more fat cells you have, the more chance of you catching it, the more chance you be affected with it, the more chance you end up in hospital, the more chance you end up in ICU, the more chance of death. So then you say, okay, so what do we do? Yeah, so diet and exercise is the first thing comes to everyone's mind. Yeah, but it's not for everyone. You're going to see why. And now there is a new generation of medications. They're amazing, but again, they're not a proven long-term solution. And I want to see that again. So at this point, bariatric surgery is the best way, which is fast, safe, and long-term to lose weight and keep it off. Well, our body reacts when we go on diet and wants to take us back to where we are. And this is what we call metabolic system, right? So if I weigh 250 pounds, my brain, my hormones are interacting around that 250 pounds set point, right? So we call it a thermostat or metabolic system or metabolic, whatever you call it, but that's my set point. If I go on extreme diet and hardcore exercise, and I manage to lose 75 pounds, I go to 175 pounds, my brain and my hormones are used to that 250, want to pull me back to a 250. So what is it going to do? It's going to increase my hunger, lower my metabolism. And that's the resistance your body does when you go on diet. Now, with the bariatric surgery, however, the minute you wake up from the operation, your set point is different. Your brain now is looking at you at 175 pounds, even though you're at 250. And what's the consequence is your hunger goes down and your metabolism goes up. That's why we said bariatric surgery is resetting your metabolic system, which is the interaction between your brain and your hormones. And because of these hormonal changes, that bariatric surgery is so successful. And that's what the scientists got the idea of Ozempic and Ozempic-like medications, because they looked into what is the cause of bariatric surgery being so successful, because it's a metabolic reset. Not only gives you restriction, it gives you resets your metabolic thermostat. And look at on my right side of the screen, these are at least these are the known hormones that are being affected naturally by going through weight loss surgery. And look at the best medication that they have right now is Mounjaro or Zepbound, that only has 2 of the components, which is great. And remember, these are not natural hormones. Okay? So this is man-made hormones is a synthetic hormone trying to imitate the two of the so many hormones that are happening naturally in weight loss surgery. Of course, putting medication on the long term. So you have to be on it in the long term. Forget about the cost. It has so many side effects. It can create thyroid cancer, loss of vision. What is going to happen to your kidney and your liver if you put this medication on a long-term basis? Okay, so this is a push for pharmaceutical to get everybody on it, and there's a really high pressure right now in the US especially to make patients take this. Doctors recommend it, everybody recommends it, that you can even get it off counter, but you know, again, I think the best way to look at the weight loss options is to look at this pyramid, right? Diet and exercise is great, but only works for a very small portion of the population. And then you have semaglutide injections, or the new ones is coming is tablets, which hasn't come to the market. And those are only working for small portion of the population. And again, your BMI cannot be too high and using this. This is for maybe for low BMI. And then you go to the endoscopic procedures like gastric balloon, endo sleeve, which is ESG, which Dr. Gutierrez is going to explain, that are again, some portion of the population works. Again, you know, it depends on your making a decision to change your lifestyle, your diet, and your activity level. So, and then it comes a gold standard, which is gastric sleeve, bypass, duodenal switch, which we call bariatric surgery. Now, it's very hard to get this life-changing surgery in, at least in US and Canada. And I know some other places that it's so expensive because it's an expensive procedure, you know? There are instrumentation involved, there is medical supplies involved. So that's why the insurance companies charge a lot of money. They don't want to give it to you. So if you're uninsured or underinsured, we are the solution for you. We are a coordination company that do all the logistics. You don't have to worry about the reservation for hotel, transportation. All you have to do is fly or drive to San Diego International Airport. We do everything else. Our procedures, our processes are being set for years. You will see how it works. So you don't have to have no worries. We basically give you the peace of mind. We give you the safety. We watch for every procedure. We're a team with our surgeons. These are exclusive surgeons, only work with us. And not only working with us, they've been with us for years. We know what we're doing. We also offer some other options that you can take advantage of, like medical tourism insurance. You're going to see all that. So basically, MBC is a US corporation that does the scheduling for surgeries down in Hospital Azar with our exclusive surgeons. MBC has been in business for 13 years. We have done over 27,000 surgeries. And it's funny because since we started publishing this kind of data, everybody's jumping on the wagon and they're putting numbers that are not true, and none of them actually matches ours, but these are real numbers. And we work with the top quality bariatric surgeons like Dr. Gutierrez in Mexico. These are the bulleted items of why choose MBC. I mean, I can go over it, but this is pretty much show you why we're number one. You see our surgeon liaison's role in the whole HQ approval, our reviews, our experience, our team of surgeons. We're BBB, A+ rated. Our complication rates are one of the lowest in the industry. Myself, I started actually working with surgeons in Mexico from 2007, the amount of experience and expertise we have. And remember, we have a team of experienced and skilled surgeons. That's why we can handle a wide range of procedures that you're going to see Dr. Gutierrez is going to go over. These are not some inexperienced assistant surgeon that they drop the price and they have time to what's up with you and do all that. If a surgeon, I always compare surgeons to the pilots, right? A pilot with 200 hours of flight time, you don't give your life to, because that jeopardizes your life and may have catastrophic consequences. You want a pilot that has maybe 10 years with 10,000 hours of flight time. I just saw a video the other day. I don't know if you guys saw, there was a Southwest plane that was just about the landing and do a touchdown. And there was a little plane that was going across the runway. And it's amazing how fast the reflection of the pilot was, because if you look at it, it's so natural. It's coming down, it's almost to the runway, and it just goes up and it goes right over the little plane. That could have cost 200 people's lives. And you see that experienced pilots are saving people's life. The same thing with surgeons. You're giving your life to these surgeons. So when you're shopping around for which company to go to, look at the reviews, look at who's their team. These surgeons that we have, they do the surgery all themselves. They're not just a name. Dr. Alejandro Gutierrez is one of the well-known surgeons in the world right now, internationally. And he is there in every surgery as a lead surgeon doing the surgery himself. He's not just a name and he's having some other inexperienced surgeon do it. Okay? So this is what you're getting with our team. Again, I want to warn you about the social media. Instagram, Facebook, TikTok are becoming very popular. You see some little cute video, you need to do research to see who's behind this company, who's running it, what the website says. You can put a website so easy and copy what NBC does, but what is their credentials? Who's running the company? I've been in the face of this company since beginning. You see me. I'm in the hospital. People see me. Actually, a lot of people recognize me because of the webinar. Well, I'm not some known, like a hidden owner that I'm hiding into. You see some of these companies, they put a US address and you Google them, it's like a home. It's like, who are these people that offering you low prices? You need to get the support. You deserve to have VIP treatment. You deserve to have top surgeons working on you. So this is a game changer. Watch this. They look too young. They don't know what to think about it. Forever. That's what we say. 16th of September, lying in my bed, I'll wait forever. It's never too late. Couple thousand miles, it's just a little space. I'll wait. So yes, so this is the project I mentioned. I started in 2021 after years of looking for ideal place for us to work. And Hospital Azar was a tribute to my mother, which I lost last year. This hospital has 4 operating rooms, has over 35,000 square feet of patients areas, and the views from the rooms is so peaceful and serene, and you have a great experience in this place because it's top of the line, the quality of the equipment. We have other hospitals reaching out to us for sterilization, for other services, because we have the best equipment out there at this point. We're in probably top 3 surgery centers in Tijuana right now. And you will see, when you go down there, you see the operating room, the everything that we have in that hospital is top of the line. And we're just getting better as every day that goes by, of course. Again, I mentioned about our process and protocols are very simple. You fill out the health questionnaire, our surgeon's gonna review it, and you see the review process in a minute. We get your approval, you get a email with your approval. You can actually sign yourself up and book your reservation, book your surgery online. Once you get your approval, you can make the deposit and book yourself on a calendar. After that, it's very easy. You just do the paperwork, you do book your flight or your driving arrangement. You show up in the day before your surgery, of course. You show up in San Diego International Airport. That's where our pickups are. And we'll do everything and bring you back. These are our prices for all-inclusive packages, which is surgeon fee, hotel, hospital, pre-op, post-op tests, medications, nutrition support, of course, private transportation. Like there's so much goes to this. Like we have 2 dedicated transportation team that work with us that have been around with us at least 11 years. I mean, these are not rookies. They know what they're doing. They've been doing this for a long time. Our support system, one of them is our support group. One thing you want to pay attention, we have a main Facebook support group that is only our patients. You find some other companies, of course, they've been around too, but they have over 30 or 70,000 members, but those are not past patients. So we keep the privacy of you being in that group, and the amount of interactions are much higher because these are real patients of MBC. They're not just some observers. And we do have other groups. If you are on the fence, we have another group which we call Inside Facebook that has a few thousand patients, but you can join that once you do the health questionnaire. But this is kind of a support you get from us. We have webinars. We have live with surgeons that is happening on Wednesdays and Saturdays if you don't have a webinar. We have coordinator lives, we have nutritional lives, we have all type of support for you. And this is a team of our past patients that are working with us day in, day out. Sarita, she's also active in Facebook and she does a podcast with Rena, Jamie, Kelly, Laura, and Dawn, which her picture is not here. Again, I recommend you watch their podcast. For people who joined later, please make sure you have a health questionnaire in our system. Fill out the Zoom poll and be present to the end. So when we do the drawing. Exclusive network of best bariatric surgeons in Mexico. This is what I was talking about. These are exclusive surgeons to us. Dr. Miguel Montalvo, Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Osuna, and Dr. Jesus Ceja. When you submit a health questionnaire, first of all, we have developed complex routines and algorithms to match you based on your qualification with the best surgeon for you. Also, our surgeon liaison, which is a bilingual doctor, sitting in the middle of this and watching the traffic back and forth between the surgeon and the patient. We also have our nutritionist and patient coordinator in the process. We assign a patient coordinator dedicated to you so they know your case from A to Z. You know how these days are so hard to get support, even with the big companies. First of all, they try to not give you a live representative. They have you go through this menu, extensive menu. Okay, press this, press that. And then they're doing an AI now. So they're trying to help with the AI, which is like doesn't know what you're looking for. So it's very hard to get to any live representative. We have our coordinators here waiting for you to call and support you. So this is the difference. The amount of support you get from our office here, from our coordinators down there, from our surgeons, from the hospital. And then the same thing goes, even when you get approved, let's say you're supposed to not take some medication or take some medication, when to start, when to stop, all that is communicated with you through our surgeon liaison and a coordinator. We use Hyatt as an option. Usually the companion goes to stay Hyatt, or they can stay with the patient in the hospital now. So that's a new rule that we changed. Our pre-op diet is very simple. It goes by the BMI. If your BMI is low, you don't have to do anything but just a 2-day clear liquid. Otherwise, it takes you, few weeks to prepare. It's very simple, just low carb, high protein diet. That's what you have to do. And the better job you do on the pre-op, it translates to easier surgery for you on the surgeon part and the faster recovery. So please make sure you do a good job on the pre-op. The better job you do, the better it is, okay? Medications, stop blood thinners, any NSAID. And again, you'll be instructed what to stop and what to start. If you are on Ozempic or any semaglutide medications, please stop 3 weeks before surgery. And look at the instructions when it's sent to you. If you are on a certain medication on a regular basis, please bring the bottles with you. Again, the day before surgery, you fly in. We want you to fly in before noon so we have enough time to do all the pre-op tests, everything else. And your departure, 2 p.m. the day after you released, the day of the when you release from the hospital. Now we have other options if you want to stay more in Tijuana, or you want to stick around in San Diego because you didn't find the right flight. We do have a deal with Hampton Inn. If you mention our name, they give you I think it's $169 per night, but that's a great deal, especially these days, with the rates that the hotels charge. When you arrive, we give you, of course, broth, jello, ice chips, and if you stay in hospital, Azar, great. Usually people who come alone opt to stay in hospital Azar because you go in there you unpack, and you're good to go. Something about packing, please pack light. San Diego doesn't have extreme weather, so you don't have to pack a lot of stuff. Maybe small suitcase is easier on you, is easier on transportation. Also, when you go back, you don't have to lift heavy weight, which is huge. Your companion, if it stays in the hotel, they get free breakfast. On the day of surgery, of course, they tell you what time, and they take you to the OR, get you prepared. You stay 1 night, 2 nights, 3 nights in the hospital, depend on the procedure you go. We do tests, we do post-op tests, leak tests, we do all that. You're ready to go home. Again, your flight should be 2 p.m. around that. This is a simplified version of the diet. You want to go from liquid to solid at least in 4 phases in about a month, okay? So post-op care is huge, don't lift heavy weight. Dr. Gutierrez is going to go over what to expect. But one of the reasons we are so successful with results and the complication rate is because we do surgeons load management. We don't load our surgeons on a daily basis. We give them just enough so they don't get exhausted, and we distribute the load among the surgeons throughout the days. So you have to remember, when you see so many people down there, it's not like for one surgeon. We have 5 teams of surgeons, 5 independent teams of surgeons. Each team has its own staffing. They have their own anesthesiologists. They have their own instrumentation. They have their own nurses, internists. So they're handling 3 to 4 patients a day. And that's why our complication has been consistently below 1%. And those are not hard complications. If anything happens when you're down there, we take care of that. And also remember to purchase MTI, because that's a huge piece of the puzzle. Okay, so Dr. Alejandro Gutierrez, he's a chief surgeon. He's a very famous surgeon. He's most wanted right now. And we have a pleasure to have him with us today. I can explain his expertise and his qualifications, but probably I don't need to because everyone knows him. He's double board certified. He's not only a general surgeon certified, he's a bariatric surgeon certified. You don't find very many of these around the world, and these are people that are dedicated to doing this one type of surgery day in, day out. And because it's laparoscopic, it's an eye-hand coordination. You want a young surgeon like Dr. Gutierrez with thousands of surgeries. This is the best combination you can find. Dr. Gutierrez, please take over and take us through all the options.
Okay, well, thank you very much, Ron. Thank you all. Good morning, good afternoon. Thank you for taking your time and being here with us. So we're gonna go into a little bit of the surgeries that we do, the procedures. Mostly we can do all procedures that are FDA, ASMBS approved, IPSO approved. So we divide it into laparoscopic and endoscopic surgeries or therapy. We have, for example, we have the lap band, which is mostly we're taking bands out nowadays. We can still do it, but nowadays we have more better treatments, better technology, and mostly we're doing some other surgeries. We have the gastric sleeve, which is the most common one, mini gastric bypass, single incisions, gastric sleeve, the wound-wise we were talking, and SADIs and duodenal switch. We have the endoscopic therapy. We're going to go in a little bit into this. So this helps. Obviously, the results are not the same as the bariatric surgery, but it's perfect for patients that have lower BMIs and they want to lose a little bit of weight. Or in the other hand, they have their BMI are too big, or they have some other conditions, heart conditions, that they cannot undergo in a surgery at that time. So we do an endoscopic, they lose a little bit of weight, and then they can go and do a surgery. So it helps greatly. And we have robotics as well. We're into it. So hopefully soon we can offer robotics as well. Okay, so we have the gastric sleeve, which is the most common bariatric surgery done worldwide. It's you can say it's a simple surgery to do, but as book said, is simple surgery to do, but it's a simple surgery to do it bad or not to do it good. So you have to have expertise doing it. So what we do in this surgery is that we go to the intestine, to the stomach, sorry, specifically, and we're gonna remove like 80 to 85% of your actual stomach. It's an approximate. We cannot tell, but it's an approximate of 80 to 85. We use a bougie through the mouth so we can calibrate. And the other part is the surgeon expertise to know where to cut. We use special staples made of titanium, very small staples. Common question is that if the body can dissolve them. Normally the body doesn't have anything to dissolve metal, but what happens is that the body overgrows all around it. So you won't feel anything, won't beep on metal detectors, you can still have MRIs, no problem. So this is a quick surgery. It takes like 30 to 40 minutes. And normally right after you come out surgery, 2 to 3 hours, we can start taking eye ships, small sips of water, and it has very good results. Normally at a year, we expect to lose around 70 to 80% of your excessive weight. So, and the metabolic process that we were talking about, a little bit about GLP-1s, leptin, all of that, it's gonna shift into a better, healthier you. Okay. We have the sills, we call it. It's a gastric sleeve, but it's a single incision. This is mostly on the outside. We do it just through an incision, a bigger incision through the belly button. So it's mostly for aesthetic results. On the inside is the same. So obviously to do this kind of surgery, we have to meet some criteria. Obviously, you have to have a low BMI. You have to do a pretty good pre-op diet so we can shrink our liver, so we don't have to use a retractor. But yeah, it's a safe and an aesthetic surgery. So it helps in that as well, and you got all the benefits of a gastric sleeve. Okay. We were talking a little bit about endoscopic procedures. Endoscopy has the advantage is it's not a surgery, it's just like an endoscopic procedure that you have just light sedation, and we can do that. In this case, the ESG, the endoscopic gastric sleeve surgery. So what we do is that we're gonna go an endoscopy first to make sure everything's fine on the stomach, on the inside, and we attach a special mechanism on the endoscope that we can do stitches on the inside. So what we're gonna do is that we're gonna put some stitches on the stomach, make it like a subplication, a gastric plication on the inside. So to make it smaller, kind of like mimicking a gastric sleeve, so you get full very fast. So obviously the excessive weight expected to lose is less, but as I was talking to some patient that want to lose a little bit of weight, or they have other conditions, it's a very good procedure. We have the Roux-en-Y, the gastric bypass surgery, still is considered the gold standard. This was the first surgery done 1950s, 1960s openly. Obviously, at that time, they had a lot of complications. Nowadays, we have very, very few mild complications, almost the same. So in this case, we get you, as we were talking with the sleeve, that's just a restrictive procedure. In this case, it's a little bit restrictive and malabsorptive. What we're gonna do is that we're gonna go to the stomach, we're gonna cut the proximal portion, we call it the gastric pouch, and then we go to the intestines. Since the beginning, we count average 6, 8 feet, and then we cut the intestine down there, we take the distal limb, bite it into that stomach, to that pouch, the other limb, we bite into the same intestine. So it has, what we're gonna do is that the food, instead of going to the whole stomach, to the whole intestine, it's gonna bypass and go to the last portion of the intestine. So food is not gonna go in contact with that portion, not gonna be absorbing calories. So that's the purpose of it. Obviously, that the more invasive that we go on a surgery, the more that you have to keep in mind and take care of taking vitamins, minerals, proteins, since that portion of the intestine not absorbing calories, it's not going to be absorbing vitamins and minerals as well. So you just have to keep that in mind and take care of a proper diet. Okay. So a lot of patients, they say, what is the best surgery for me? The gastric sleeve, gastric bypass. It depends on every patient. As we were saying, if your BMI is on the lower levels, a gastric sleeve will help. In any one very important thing is that if you have a very bad acid reflux previous to surgery, in that case, the best thing to do is a gastric bypass. The gastric bypass is the best surgery for acid reflux or GERD. So it depends on every patient. Normally, when patients, you can fill out the health questionnaire and we can approve you for one surgery. But when you're here, we go in and touch and then check all your background, see your lab work at the day, your previous one, and we can tell which is the best surgery for you at that time. So, okay. We have the one anastomosis gastric bypass. It should be called OAGB, but since it's less surgical time, it's called mini gastric bypass. Sometimes the word mini could be misconfusing, but it's a type of gastric bypass. The difference is we're gonna go to the stomach, we're gonna cut the stomach as well. It's a little bit longer, the pouch that we call it, and we go to the intestine and we're gonna count the same 6 to 8 feet. But the difference is we'll not cut it down there. We take it as it is and bite it into the stomach. So we call it an omega loop in surgery. So instead of having to cut, to suturing, to staplings, it's just one. So less risk of bleeding or a leak. And the results, we got amazed because 10 years after, and the results compared to the Roux-en-Y are the same. So very good surgery as well. Okay. So if we compare the Roux-en-Y gastric bypass with the mini gastric bypass, so in this case, the difference is going to be mostly one, the acid reflux. Still, if you have bad acid reflux, Barrett syndrome, Barrett esophagus, problems with GERD, the best thing to do will be a Roux-en-Y gastric bypass. Other than that, the mini gastric bypass, if your BMI is not that big, the mini is an excellent choice as well. Obviously, both procedures are good for patients that have diabetes, high blood pressure, uncontrolled diabetes, taking 3 or 4 medications. So this helps a lot. This is a bigger metabolic effect. We have this surgeries are the most invasive surgeries, but the ones that have better results long term. We have the duodenal switch and the SADIs. You can compare them to the duodenal switch as the Roux-en-Y bypass and the SADIs as the mini gastric bypass. But in this surgeries, what we do is that we gonna make a gastric sleeve first, take that portion out of the stomach. And then the anastomosis of intestine is going to be, instead of being in the same stomach, it's going to be on duodenum. So the difference is, instead of counting the intestine since the beginning, we're going to count it since the end, okay, from the colon. So normally, nowadays, we're doing like around, some say 3 to 4 meters, best thing to do at 4 meters. So you're going to have just very, very light 10 feet of intestine absorbing calories. So obviously this is a more invasive surgery that you have to take care of on vitamins, minerals, protein. If you not take proper care on your diet, you can have more diarrhea. So things like that. But if you if you do follow the indications, so you're gonna do excellent results on losing weight and its related complications. So we have just to compare both of them in the duodenal switch, we count the intestine at the end, we cut it, take the distal limb, we get a bite into the duodenum, and the other limb we bite into the same intestine. And the Sadies, we take the intestine as it is and bite it in do the anastomosis in the duodenum. So mostly same results are the same, and pretty good results at the moment. Obviously, well, obesity, it relates to a lot of diseases, even some types of cancer. We have patients that use CPAP machine and after surgery it gets better. And PCOS is one very common that PCOS, polycystic ovarian syndrome, is related to some hormones that are made on our fat cells. So obviously increasing your BMI or being obese, it increases the risk of having PCOS. One thing with PCOS is that patients, their fertility rate decreases. So after having surgery, obviously you're gonna lose weight, your hormones are gonna shift and regulate. And we have a lot of patients that previously to the surgery, they were struggling to get pregnant. And right after, we are happy because they tell us that they got pregnant after once, twice, 3 times, some patients. So we're very happy with them. And yeah, your fertility rate increases a lot. So that's one option as well to do a bariatric surgery. One common question, and I was seeing one of the questions today, that how long can I return to work? How soon can I return to work? So normally we recommend in general like 2 to 3 weeks, but this is going to depend on the type of work that you do. That's the most important thing, and the surgery that you have. Obviously, your age, related diseases, all of that. But if you do like a desk job that you don't have, you're sitting, you don't have to lift heavy things, be walking around, doing too much movement. So we recommend 1 or 2 weeks. Some patients even are a week, they're returning to work. And that's going to depend later on if you do like a heavy kind of work. So in those cases, we prefer to wait like 2 to 3 weeks, sometimes a little bit more in specific cases. We have to keep in mind that, well, you're going to be doing a pre-op diet, and this is going to help you and help us in the surgery. But obviously your energy levels could be decreased the first couple of weeks. Right after, you're going to continue on just liquids. So it's obvious that the body could have a lack of energy. But you just continue doing your diet, taking care, and then after you have double energy. So patients, they later told us that they can play with their grandchildren, and they can do a lot of stuff that they couldn't before surgery. So that makes us happy as well. Okay.
Thank you so much for taking time and going over the wide spectrum of bariatric surgeries we offer. Financing comes to picture if people need to borrow money, and my recommendation is to look into your bank if you have a good relationship, especially if it's a credit union. There are other options like SoFi, Lending Club. All those are good. We have several lenders on our website that you can also look into. Canadians specifically need to look in Medicard. My recommendation again is not to fill out too many applications at one time, because that every time you fill out an application, it hits your credit score. And yeah, so one thing I noticed is please put your questions in the Q&A tab, not in the webinar chat. The Q&A tab is where you can ask questions. Like I see some question right now, which I'm gonna maybe take a look at it if I have time. Okay, so medical tourism insurance, what we call MTI. This is a huge opportunity because we have negotiated this provider for the best in the industry to offer us like a wholesale discount, and we're passing that discount to our patients. At $179, you can buy this insurance, which covers from the time you travel to the time you get home and 45 days after surgery. So you have coverage when you go back home. Normally, the complications happen when you're down in Mexico, which we take care of. And but if you have any incident when you go back, you can take advantage of it. Of course, it covers any complication from the time of the surgery to 45 days. I highly recommend you buy this. It's so inexpensive and it gives you peace of mind. And it's better to have something, not use it, and not having it when you need it. Our nutrition program is extensive. We offer Emerge Bariatric Vitamins, which is the best bariatric vitamins for post-bariatric patients. You see the different types that we offer. It comes in soft chew, chewable, drinkable, and capsules. You can buy it from going to emergebariatrics.com. We're going to have actually a display of these in our hospital soon. So when you go down there, you can see what we have. These are made from the best ingredient and according to the ASMBS recommendations for post-bariatric patients. Our website, I recommend you check out. It's pages and pages of information, articles. We put blog posts every week or two about the new stuff coming, scientific research, cases, testimonial, and okay, so we're getting to a Q&A session. So I want to release the Zoom poll, like I said. So please watch for that. It's 5 questions and it's simple question. Please go ahead and answer those. I am going to also see here. Okay, I want to show you. Yeah, so we wouldn't wait for the for you guys to do the Zoom poll. There are some patients, I'm just looking at the webinar chat, not the Q&A. There are some patients that they're comfortable driving to us, so that's completely okay. Our addresses are on the map. Our hospital or hotel, Hyatt, you can drive either way. You're more than welcome to do, but just this is the stuff that patient coordinator, we call them PC, that handles for you. So you tell them like, this is where I'm coming, how I'm coming, and we get that all into your file. Yes, the prices that we have, they're all in US dollars. So for Canadians, they need to give us US dollar. The best way that patients do, they put the deposit down and they get a cashier's check. They send the picture to us 2 weeks prior to the surgery, so we know this is how they're going to pay. Whether you pay in cash, cashier check, however, you need to be paid 15 days before. And what they do is they take the cashier's check down there. We know they're bringing that, and then they collect it at the time of arrival. Well, I mean the hospital, Oscar or Annabelle. Dr. Gutierrez, you want to talk about hair loss after weight loss surgery since we're waiting for?
Yeah, yes, of course. Yeah, that's a common question, very important one. Obviously, we all love our hair. Normally, any condition that makes you get too stressed like this, you're going to surgery, your body is going into a very important change, a lot of stress in your body. Um, Adding you're gonna change your diet and all of that. So normally we expect to have hair loss or your hair gets a little bit more fragile around like from the third to the 6th month after surgery. It's very important for you to follow the diet, take vitamins, minerals, your protein. If you have your primary care doctor can check that out after, do a follow up and check vitamins, protein levels. So that's very important. But so this is just a temporary problem that you can have. This is expected because your body is going to a constant change. So normally we expect a little bit more hair loss from the 3rd to the 6th month. You continue your diet and it will regrow back again normally.
You know, like we always said, the first two years is honeymoon, but you have to do the right diet and right vitamins, so this would last long. So down the road, in 7, 8, 10 years, you still have a good bone density. You still have your nervous system untouched, all that stuff. That's why we recommend the bariatric vitamins for sleep patients. At least the first 2 years, bypass probably 5 or more, and then DS for probably permanently to take these medications. Yes, so something that we do, which is unique, is we do help you with FMLA paperwork, and that's included in our package. That's one of the other reasons you go with us. So the FMLA work for your work to take time off, all that, we do help you with that. Again, the vitamins is emergebariatrics.com. You go there and you see the vitamins. Okay, so when you asked me about the prices, I told you the starting prices. Some of the surgeons are slightly lower or higher. So you just have to ask the coordinators for specific prices. Also, there are other factors like BMI and like if the doctor finds a hernia during the surgery, gallbladder, all those extras. Okay, so the way it works with companion, right? So the companion comes with you. If you select to stay in the hospital, of course, that you go there. If you stay in the hotel, the first night you still together, then we make reservation for your companion to stay more in the hotel when you go back to the hospital. So this is how, so you go the first night in the hotel together with your companion, then your companion stays behind, you go to the hospital, they can come and visit you, but they stay there at night. Okay, so let's see. I think we're gonna continue answering the questions. So Dr. Gutierrez, Maria is asking if a patient has H. pylori or any bacteria, how long they need to wait in order to get a weight loss surgery?
Okay, good. Yeah, well, H. pylori, it's a common uh, bacteria in the stomach. Normally, that you will have to, if you have the diagnose, they were gonna give you a treatment. So normally, the treatment is 2 to 3 weeks of medications, antibiotic, omeprazole, Prilosec. So the best thing is that you do that treatment, and then after do some other studies, lab work, or stool you can get detected, and to just to check if that's gone. That would be the best treatment, the best thing to do. So, but normally if you've done the treatment properly, normally it eradicates H. pylori properly.
They're asking what type of test is done before the surgery.
Okay, mostly it's pre-op testing. So what we do is that we do we're gonna check your hemoglobin levels, white blood count, red count, red cells count. We check your coagulation times. That's very important to have surgery. And then some are testings. Sometimes, if necessary, we can check your liver function, thyroid function, and that's lab work. And we're gonna do an AKG. You see your heart, how it's doing. And in some cases, we do X-rays. And all of this is checked by the internist, okay, who's gonna do as well as do a clinical history, all your background, medications that you take, and check all the tests that we did on you.
And then something I need to mention is we highly recommend you do a hemoglobin test or just a blood test before you come. Is because if your hemoglobin is down, it's better to start taking care of it when you're in US. Because if you get down there, we may have to do a blood transfusion or whatever. So it just makes the process a little bit lengthy. But it's best if you know, especially for patients who are doing revision. If you have done a previous surgery, like a bypass, your hemoglobin could be down. So please check on that. And then the post-op, we recommend 3 months after surgery to do a blood test, make sure everything is checking. And then after that, just have a regular checkup with your doctor, your general doctor. Okay, and okay. I don't know if you can download the questionnaire, Jeanette. I think you have to do it online. So yeah, you have to do the health questionnaire online. Yes, so again, once you put your deposit, the balance has to be paid, or we know how it's getting paid 2 weeks prior to the surgery. Some people actually do like a layaway. So they book their surgery and they pay every week or 2 or whatever toward the surgery, and at the end is all paid. But it has to be paid before you get the surgery. So the hospital is 40 beds. About, I would say 30, some of it is single room, private rooms. Actually, we don't have very many double bed. So those are reserved for patients who come together, their partners or their friends, and they ask for that. So usually you're in your own room, private room when you're in the hospital. So, oh yeah, that's another question about sharing a room. Yeah. Okay, Dr. Gutierrez, do you have to stop TRT before gastric sleeve surgery?
No, you can still continue doing the therapy. Obviously, it will depend on why are you doing the testosterone therapy, but you can still continue doing that. Only we found when you're here that we found some lab work that are normal or they have to be changed. So maybe we will change that. But no, you can still take it. Only obviously the day of the surgery you will stop taking it.
So they're asking about the pre-op. So pre-op could be, depends on your BMI, it could be from 2-day clear liquid to a few weeks of low carb, high protein, right? Like 850 calorie a day. So just have salad with fish, chicken, things like that. Okay. Again, um, so any question for the prices and things like that, please check with your coordinators because everyone's schedule is different. Which doctor, what time frame? We have specials for some time and not some other time. So please check with your coordinators. Does the stomach stretch over time with gastric bypass, like it does with sleep?
Well, obviously, the stomach is it's mostly muscle. It has two layers of muscle. So obviously, with time, or if you do not follow the indication, you start eating a lot, it could stretch a little bit, but just a small amount. Some patients they tell it's gonna stretch to its original size, but no, it can stretch a little bit, and obviously it does just a little bit. Obviously, in the gastric bypass is less because we're gonna be leaving less portion of the stomach as the gastric pouch, but it could stretch a little bit. That's gonna depend on you taking care of your diet after.
Okay, so Elizabeth is asking, what happens to the intestine that is bypassed in mini bypass or IRY? What happens to the extra tissues?
Okay, yeah. So as I was saying, normally that intestine in the like in the room, why you connected it into the same intestine. So still it's gonna produce hormones, enzymes. It's gonna carry bile, pancreatic enzymes. But it's not gonna be in touch with food. So you can there's some studies that we're doing. So very important part of this communication between our brain and our gut is the bacteria that we have there. Bacteria meaning the flora or the good bacteria that you can say. So after this, in that portion of the intestine, the bacteria changes into another type of bacteria that's it's good for us, that it's better. So still it's gonna be home for that flora and it's going to be part of the metabolic effect. So still continue its job, but it's not going to be in touch with food, absorbing calories or vitamins, minerals.
The patient is asking, I have a mini bypass and I'm gaining weight. What is the best option, revision or options for me?
Okay, in that case, well, the best thing to do, it will be like a two type of a surgery in the same surgery. So convert it into a room Y and make a distalization. Distalization, we make the bypass even longer. Actually, in the morning, I did a revision bypass to bypass. So patient had a great success with their first bypass, but they started regaining the weight. So what happens is that 10 years ago and back, they did like 3 feet in bypass of the intestine. Nowadays, we're doing like 9, 10 feet. It's getting more aggressive because we've seen that patient can regain the weight. So that's what we did. We did the distalization. So in this case, we can do that as well, and it's gonna help.
Again, the MTI covers you no matter where you fly back to, whether you go to US, Canada. If you have complication, they cover you. But I'm not sure, of course, Canadian healthcare is free. So, but still, if you have complication down in Mexico, anything that is related with 179 is just peace of mind to buy. Okay, so a bunch of these questions again is repeat. Is it possible to lose too much weight?
There's the chance, there's a possibility, but normally we've seen that it's more common to regain the weight than to lose too much weight. Actually, in the morning, I was talking to my patients from yesterday, and they were asking me the same. How can we know when we're gonna get to our normal body, our ideal weight weight, and not to go down even? So normally it's very rare to you can go the other way if you have a proper diet, if you're taking your vitamins, minerals. So it's very rare that you go to the other way. What we recommend is that you do a follow-up with your primary care doctor. If you have a nutritionist, that will be better, mostly for long-term results. But the most common thing is that your body adapts, creates mechanisms to adapt. Well, our body's made to absorb the energy, not to throw it away. So with time, you name it, all kinds of surgeries, as I tell the patients, is still a tool. The body, it's gonna develop some mechanisms to absorb more, try to absorb more energy. So that's more common that to go to the other way. There's still cases, but that's because of other reasons.
Can you explain mini gastric sleeve? There were some questions about mini gastric sleeve.
Okay, yeah, well, there's all around the web that they offer the mini sleeve. Mini sleeve, you can they call it the mini sleeve, like you do a gastric sleeve, but you, instead of taking like 80 to 80% of your stomach, you take less. So some patients, they say, I want to lose weight, but I don't want to have that restriction. I want to eat a little bit, enjoy food. So there's some patients that they ask to do a mini sleeve, we call it. So yeah, if that's the case and patient doesn't have any other problems, diabetes other than that, we can do the mini, we can take less. Obviously, I tell the patients, we have worldwide data, FDA approved, is the original gastric sleeve. If we take less, we're not gonna expect the same results. You can regain weight or not lose the amount of weight that you could with a regular sleep. But yeah, until the patient asks us, and we can do that.
So I did mention about hiatal hernia. Can you explain what you do when you do the surgery? You check for that, and then I explain the extra fee.
Yes, of course. Hiatal hernia, it's common in patients that are overweight because pressure inside the abdominal cavity increases. So up to 30% of patients that are overweight could develop a hiatal hernia. We have the diaphragm, okay, muscle that divides the thorax from the abdomen, and that muscle has some special openings for structures to pass. And one of them is the esophagus. So normally that opening has to have its size, which is like an inch wide. But with pressure from the abdomen, that opening increases in size. So our esophagus is like a rubber band. So what happens is that if that hole increases, the esophagus pulls the stomach through into the thorax. So most common symptom is acid reflux. Not all patients have that, but it's the most common. So we have a valve in between the esophagus and the stomach. For that valve to work properly, it has to be in its proper place. If it's in the thorax, up here, it's not gonna work. So you have more chance of having acid reflux. And when we do a restrictive procedure as the gastric sleeve, pressure inside that small stomach increases. So patients, even without symptoms before, if we leave a hernia unrepaired, they're gonna have acid reflux. So yeah, we go and check that, and if we have it, we dissect, and we're gonna make that opening, we're gonna make it smaller. We put stitches on it. It's called chloroplasty. So we take picture before and after. So normally we show the patients what we did, and that helps.
Thank you. There's another question along the same line. If they have umbilical hernia, can they still get gastric sleeve?
Yes, you can. Actually, all type of abdominal hernias, if you lose weight, that is always better. Nowadays, it's a debate of if you should do a bariatric surgery to lose weight first, or lose weight and then repair the hernia, or the other way. But yeah, we can still do hernias. Obviously, there's small umbilical hernias and they are very big. So, but yeah, we can still do it. Losing weight is gonna help a lot. Then later on, they can repair the hernia with better results.
So like I said, most of our rooms are single. And again, this depends on the load of the hospital. They arrange all that when you get down there. You can request to be on a double with your companion, but we don't have guaranteed. There is a recliner that is guaranteed in each room. But then I don't know if you can get a 2-bed. So that's all depends on the load of the hospital. When you get down there, you need to ask your coordinator. They're asking about skin removal. Yes, that's actually has become a major point after we started the hospital. A lot of our past patients coming back for plastic surgery. Our most popular procedure right now is mummy makeover, which is a combination of multiple procedures, like maybe breast lift, tummy tuck, body lift, arm lift, thigh lift. Of course, we do anything simple from eyelid surgery to face to body. We have few, not only board certified plastic surgeons that we work with, we also have, they are experienced in post-bariatric patients. I just need to take time to mention that because post-bariatric patients are special with their skin, with everything else. The characteristics of those patients are different from normal patients. So you need to make sure the plastic surgeon is specialized in post-bariatric patients and for best results, okay? Is hospital fully accredited? Yes. We have full accreditation of federal government of Mexico. Everything is up to code in this hospital. We are also looking for more accreditation from JCI. This is something that our medical director and I and our other director are working, of course, Dr. Gutierrez involved to make JCI, but hopefully soon we get that too. I think they're talking about, I don't know, explain bumping or burping. I don't know. What is bumping, you know?
I think it's dumping syndrome.
Dumping. Oh, yeah, dumping. Okay.
Could be. Yeah. Well, if it's dumping syndrome is a reaction of the body that normally we see it in the gastric bypass, but nowadays we know that in gastric sleeve you can have it even without any surgery. You can have that in the gastric bypass. What happens is that we're gonna connect the stomach to the intestine directly, so food is gonna pass directly into the intestine. When you have like a big meal, a big carb meal, liquid shakes, you eat too fast, so food goes directly into the intestine. The intestine normally handles pre-digest food from the stomach. So if it comes as it is, doesn't know how to handle it, so it starts to liberate a lot of hormones, and those hormones cause you to have like heart rate increases, blood pressure, you get sweaty, blur vision, nausea, vomiting, diarrhea, even you can faint. So that's called a dumping syndrome. Obviously, you can have it more with the bypass, but in the gastric sleeve, if you eat like too fast, or if you eat like a shake full of carbs, um, you can have that. So normally it's not that bad, but yeah, normally you have to learn to eat slowly, to separate food from solid from liquid, and yeah, once then you can have that, but that makes you be conscious and not to eat too fast again.
Do you want to talk about incisions in gastric sleeve and how sometimes you can get away with less incisions?
Yes, of course. Normally, the incisions that we do is it could be 3 to 5 incisions. We always try to do the less possible, but the same, we have to do a safe procedure. So that's gonna, your pre-op diet is gonna be very important on this. If you patients done a good pre-op diet, they take care of what they eat, we seen that their liver shrunks very greatly. Tissues are less inflamed, so we can do the dissection better without less bleeding. So it's a complete different surgery. Normally the biggest incisions are less than half an inch, okay, and the other ones are half of it. So sometimes we can do 2 of half an inch, and the other ones are less than a quarter. And sometimes we are able to do the just 3 incisions, 3 very small incisions. So we always try to do it, but we don't risk security for that. So anyways, they're very small, so it won't show any scar, just a small line as in any laparoscopic surgery.
Actually, you may want to mention about the sleep, let's say a sleep procedure, how long it takes, how long the surgery it takes, how long they're going to be in recovery room, and then something I need to mention before you go. So again, they asked of us our accreditation. So when you get accredited on the right way, of course, not bribing to get it, is you have to have everything, all the procedures, processes in the hospital according to the code. And these are like international codes, right? So it's this same code that applies in US, applies in Mexico. It's not like they do something different in Mexico because they are in Mexico. So we do what we call a white, gray, and black areas, right? So we don't mix all these up, right? So the companion cannot go to the areas where the recovery, for example, or the sterilization, or so these are different areas. So once the patient get out of surgery, they go right away to the recovery area, and those are the areas are all still sterilized. So we don't allow public to go there. Only surgeons and the surgical staff are allowed to go there. So, but I'll let you talk about like what's the sleeve, how long it takes, how long they're going to be in recovery room, and then back to their room.
Okay, so well, in every surgery normally, well, if we were to do a gastric sleeve, normally we surgeons, well, you get from the hotel to the hospital. In the morning, very early, you start to prepare yourself. They put you in a gown. They do the IV, check your vitals, everything, and then the internist comes and do the pre-op evaluation. And then our surgeons go and get through the surgery. All questions that you have get answered. And normally in the gastric sleeve takes like 40 minutes. Okay, they take you into the OR. As soon as you get there, we start doing IV medications. You feel completely relaxed at the minute. And you go to sleep, you wake up, and surgery is over. You're gonna go into the recovery room, and normally we keep an eye on you there, like around 45 minutes to an hour. Do medication, be checking your vitals for you to recover, and then you head back to your room completely awake. Every patient is different. Some of them like to sleep a little bit, or they need more time to get their medications of anesthesia out. But normally, usually patients are 2 to 3 hours after surgery, and they're walking in their rooms, walking around the aisle, and that's the normal, the expected recovery time. Normally, well, as soon as you wake up, we can start doing night shifts. Okay, so you can start taking small sips of water. So that helps because patients normally they want to take a little bit. They're thirsty, and then we wait 24 hours. The next day in the morning, we do a leak test. It's just quick, like an X-ray machine, gonna give you two gulps of habilitation diet so we can see it pass through. Yeah, be sure that everything's okay. And then we start with liquids, properly liquids, so water, apple juice, get ready to start. And we wait the rest of the day, that day, just making sure that they're passing good, causing no pain or nausea. And you say that one more night, and then the next day, if everything's fine, you're ready for discharge. Obviously, prior to the discharge, we're gonna go and give you a folder with all indications of the first part of the diet and your medications, and we're gonna go through each point.
I think about the loose skin again. So not everyone gets loose skin and needs a skin removal. Depends on your genetics, your skin elasticity, how fast you lose weight, whether you exercise or not. These are all factors. And then amount of weight also you lose too, right? But not everyone needs it, but a lot of patients do. How do you minimize it? Again, just the level of activity, just to make sure you don't lose weight too fast. Sometimes patients use cream or for stretch mark or things like that to help out. So if these patients say, I have developed terrible reflux after I got my sleeve, so what's my option?
Okay, so yeah, well, that happens in some patients because as I was telling you about the pressure, and mostly if you regain weight because of the pressure, yeah, patients could have a bad acid reflux. In your case specifically, the best thing to do will be converted into a room-wide gastric bypass. The room-wide gastric bypass is considered an anti-reflux surgery, so it's gonna help lower the pressure inside the stomach and helps losing weight. And the bile that comes right now comes near the esophagus, it's gonna get connected into the last down in the last portion of the intestine. So that's the best treatment for you in this case.
Have you done gastric sleeve on someone who has ascites inversus?
Yes, yeah, once we did it. Yeah, same technique. Obviously, your hands are on the other side, but and obviously it's not that quick, but yeah, we can be able to do the surgery.
I think I was pretty clear, but I want to make sure, the patients now have option to keep the companion in the hospital. So they can stay in the hotel when they're in the hospital, or they can stay with them in the hospital. So one good thing about gastric sleeve is you have more revisional options if you need it. We find 5% of our patients need revisional. Again, the published data shows 15%, but in our patients, we experience 5% need to have revisional surgery. And it's a harder surgery for bypass to be revised or duodenal switch to be revised. But we usually don't see DS revision unless there is a complication. And there are options we can do. Sometimes the surgeon can do a bypass to DS, which you hardly find anywhere else, but those are very rare. But sleeve is easy to do, go mini bypass, DS is a done deal. So at this point, we offered nutritional support unlimited. So you can come back and ask questions. Again, we have webinars, all that stuff. We do surgery from Monday through Saturday. So you can have your surgery on Saturday.
Oh, yeah, well, normally we do it from Monday to Saturdays, and some special cases, even on Sundays, we can be able to do it.
When I mentioned about our complication rates, it was for all surgical, for all the surgical teams, for all type of surgeries. Remember that when we said we have less than 1% complication rates, considering the type of surgeries we do, that's amazing. There are surgeries that we do that no one else touches in US or Canada. They don't want to even deal with those type of surgeries. Whether it's been a bypass that has been done 10, 20 years ago, gastric banning that they did before, so there is a lot of stuff that we do that no one else touches. And considering that, our complication rates are mainly the worst ones that you can develop down in Mexico is bleeding. And that's a very easy fix. We just do a reintervention and we fix it. That's why we monitor you for, the 2 days or 3 days in the hospital is what is crucial. And that's why we keep you long enough there. Is not, we don't do what they do in US, which is like they're trying to do this outpatient because the hospital costs money, If you run the hospital with a code, you need staffing, you need nurses, you need all that infrastructure that costs money. Again, some of us, we talked about BMI. Our cutoff BMI is at 30 for gastric sleeve. Of course, ESG and balloon could be a little lower. And we do have some surgeons that they take a little less for VSG, maybe 28. But that's why we have this team of surgeons that each one offers a certain type of services that enable us to cover everything from low BMI to high BMI, from VSG to mini bypass to DS to SADI, reversal. But the lowest BMI for single incision, Dr. Gutierrez, is about 30, right?
For single incision, normally it's around 30s. But that's gonna depend on your different factors of your BMI, your size of the liver. Sometimes there are very, very patients that are 30 of BMI, but their liver is very big. So that's gonna depend on your diet, pre-op diet. And normally we're gonna try to do it at a single incision all the way. But sometimes because of certain criteria, we can not able to do it. And in those cases, we do it with just very small incisions.
You know, we have about 50 plus more questions. We are almost getting to our 2-hour mark. I want to make sure we don't lose everybody. And so please, again, if you didn't hear your questions answered, please circle back with our coordinators and we will be here to answer. I have a list of all the qualified people who attended this our webinar today. In this year, I'm going to draw one name and see who is our winner for our, oops, I'll put this back. Make sure that I mix them all up good. Okay, so this is the one. I'm going to show it to you first and then read the name. Kyra Gayton Kaiser. I hope I didn't say the name wrong. I'm gonna look for you, Kyra. There you go. I'm going to let you talk. Kyra, please talk to us. And yeah, you're on mute. If you want to unmute yourself, please. Are you there, Kyra? We'd like to talk to you. You're on mute, and I let you talk to us. Okay, for some reason, she's still on mute. Anyway, we will try to contact you after the webinar. Thank you so much, everyone, for joining us and trusting in us. Thank you so much, Dr. Gutierrez, for your time. I know you're busy. I appreciate you. We'll see you guys next time, or we see you down there in Mexico. You guys take care and have a great weekend and keep up with this. This is a life-changing opportunity. Okay, goodbye. Bye-bye.